The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome to the Healthy Image Podcast, where we talk all things health and wellness. Today we have a very special guest, Dr. Galen Goben. He's an experienced thanatologist and pastor with over 3 decades of guiding individuals and organizations through transitions, loss, and healing. With a compassionate and deeply human approach, Dr. Goben accompanies people as they discover their personal path through grief by fostering understanding, courage, and emotional resilience. Throughout his career, Dr. Goben has combined his background in counseling, coaching, and ministry to create safe, trusting spaces for those navigating pain and uncertainty. He believes that grief requires both skill and heart, the ability to listen deeply, communicate with empathy, and help others find meaning in moments of profound change. At the core of his philosophy is compassion, the atmosphere in which growth, trust, and healing can truly take root. His work continues to inspire others to face life's hardest season with strength, faith, and hope. Welcome, Dr. Goben.
Thank you.
Welcome so much, Dr. Goben. It's a pleasure to have you here. I know we go way back too.
Yes, we do.
From our prior organization,
Yeah.
and it's such a pleasure to see you and reconnect with you.
Thank you.
And we are so grateful that you're here.
Thank you. And by the way, it's Galen.
Okay,
it's just,
wonderful.
just
Wonderful.
Makes it better.
Wonderful. Galen, thank you again for being here. You've dedicated so much of your career helping people. How did you first begin this work?
Well, I stumbled into this. I always kind of had a affinity for being with people and supporting and listening and things. Became a pastor many years ago, and it was actually through doing funerals with people that I moved into this work, listening to them, helping draw out what their stories are about their person, trying to build and create beautiful rituals that were representative of the person themselves. And out of that then became a thanatologist, which is a big, long word for the world of dying, death, and bereavement, of which grief is obviously a part of that. And just sort of walked my life journey, learned a little bit here, learned a little bit there, found how important it was to me and what a difference it would make in the world. I wanted to be a sportscaster as a kid. And it didn't make enough difference. And so these kinds of things, as you just walk your journey in life, you find your path.
Absolutely. And it's so good that this is something that you found that you're passionate about, because in the past when I've worked with you, you counsel and work with families in such a compassionate way, and you're so good at it. So thank you.
Thank you.
Many people think of grief only in connection with death, but it can start long before that. How do you define grief after receiving a cancer diagnosis?
Well, there's so many things that goes into what our life and what we find is important and hold in value in our life. When you have a value about yourself and it gets challenged, when you have an assumption about yourself and it gets, destroyed oftentimes, which is what a cancer diagnosis can do. You think of yourself as a healthy person and you're fit and maybe you work out and all these kinds of things, and then you get this diagnosis that goes definitely against what your self-image is. And when that does, there's a grief experience with that. And so it really is grief is something that is not just with somebody's death, or we are come to understand like divorce or retirement or some of those things, but it really surrounds us all the way around our life.
Wow. And it sounds like grief is triggered when there's an life-altering, something that's really life-altering, a huge change.
It's not even necessarily huge, and that's one of the things I think that goes into that misconception about it. It doesn't even necessarily have to be a huge change. it gets into the small kinds of things that I know we're going to talk about more in today, but like, as you go through the treatments or things like that cancer will bring along with you, and
Yes.
it impacts your energy level.
Wow.
That is a huge thing, and somebody may not think it's quite such a huge experience for them or whatever, and yet they can really struggle through that because it, again, it goes to the core of who I am, and I've been healthy, and I've got energy, and I used to be able to do this, and why can't I now?
Yes.
That's a grief question.
Absolutely. And what emotions or stages do people commonly go through when they first hear the words, "you have cancer"?
Yeah, that is a real broad and open-ended question. And because there's not a standard thing for everyone. Grief is so personal,
Yes.
so individual with a huge variety of factors. We were talking earlier about the complexity of things, and grief is a really, really complex kind of things because, or experience, because we as human beings are incredibly complex. There are some common things that people may go through, which, a sense of shock. It's like, what?
Yes.
Wait a minute. This is, you go into the doctor's office, and in some ways you're kind of expecting something and all. But for a person to say you have cancer, that becomes now something that has to be integrated with you, what that experience is. And it's like, wait a minute. And shock, denial, and I want to be always careful with a word like stage or phase, because that sets up some kinds of things that can be problematic in a person's grief. But there are, some of these common things are, a sense of total confusion. Some people may even have an experience of numbness, especially early on, not being able to find or identify the emotion that they're feeling, and they may be kind of almost on overwhelm. And in realities, in a grief, a very difficult grief experience, numbness is not unusual, where somebody doesn't feel anything because our emotional self shuts down. It's a self-protective kind of thing, which is part of what the denial is, or the shock, or any kind of way that you might understand that, because it's sort of like stops something before it gets in, and then begins to let a little bit of the reality of this in at a time.
Wow.
So it's hard to say, this is what you're going to feel, or here is where you're going to go, because everybody's different.
And so my son, at 2.5 years old, he was diagnosed with leukemia. And so it's interesting that you say, the different, we'll say different types of grief, and
Sure.
when you feel different things at different times.
Right.
Because, I remember being in, we started off in urgent care for a fever, sent us to the ER because his blood work looked bad, and every time they'd send us somewhere else, my mind never went to cancer. My mind went to, okay, the kids are sick again. What is it, flu
Sure.
or COVID? What are we, it's like our mind didn't even go there. So then to go from, urgent care, ER, okay, we have a problem here, come back tomorrow, we'll do more blood work and we'll see what we're working with. And they had mentioned, it could be leukemia, or it could be an infection in his bone marrow. And I'm like, okay, so he has a bone infection. Like,
Exactly.
it was like, okay, well, it's obviously not leukemia.
Sure.
It's like you're in this denial until we got the actual, it took a few days to get an actual diagnosis with bone marrow biopsies
Sure.
and everything, but they were pretty sure. We had an action plan before he was diagnosed, because they were sure that's what it was. So, we got I'm 80% sure your son has ALL. And my reaction and my husband's reaction were so different, and we were in the same room at the same time getting the same news.
Right.
And our reactions were so different. And I
Sure.
think even through, it's been over a year now, but our it's like we're always on like different like wavelengths.
You're on different pathways.
Exactly.
Absolutely. Do you mind sharing a little bit about what maybe your experience was, some of the small minor things in relationship to Luz's question here about those initial sorts of things that you had
Yeah.
as related to your husband?
Yeah. So for me, it was, I don't know if it was like the mama bear and wife in me, but you know, my husband took it very hard. And I did too. Like I remember sitting in the chair holding my son, and the urgent care doctor on that day when we got the unofficial diagnosis, you know, she was so sweet and compassionate, and she came up to us and put her hands on our shoulders and said, "I think your son has leukemia. We're going to admit him and get you an oncologist today." And my husband he just broke down.
Yeah.
I was like, it's going to be okay. Like I was like trying to protect him and,
Right.
you know, my son Jonah. I'm like, it's going to be okay. He has a big brother. And my mind's like, okay, how are we going to navigate this? It didn't hit me yet.
Right.
And then we go up, you know, get admitted. And it took, I felt really sad and really, really mad.
Sure. Yep. Okay. So
I was very
back
mad.
to your question, mad
I
and
was
everything.
so
Wait a minute,
mad.
this is not right.
Right.
Anger.
Yeah. I'm
Yep.
like, he's a baby.
Yep.
Like why? And then I felt guilt. Like, and all of this was like all the same day.
And they all came like this, didn't they?
Yeah.
Bang, bang, bang,
And it was,
bang. Yep.
so then it makes you feel numb because
Right.
it's honestly a feeling that I had never felt before.
Right.
It was an emotion I had never, I don't even know what you would call it.
It's hard to describe.
It's hard to
isn't it?
describe
Yeah,
because
yeah.
I felt really sad, scared, angry, and guilty because in my mind, and the first thing the doctor said was, it's not your fault. There's nothing you could have done. And in his case,
Sure.
and I'm sure it's like this with all childhood cancers, is the doctor said he's too young for any outside anything to have affected him to cause cancer. He hasn't been on this earth long enough for something to have caused cancer. Something just happened and his genes mutated.
Yep.
But in my mind, I'm still, well, I carried him for 9 months. I breastfed him for a year and a half.
Yep.
You know, it was just like, I felt so guilty.
Yeah. What poisons did I bring
Exactly.
in to give to him?
Exactly.
How do I find blame or place blame or some kind of causation in this, which becomes is really important for us as human beings and really difficult to do
Yeah.
when there's not.
Right. Yeah. But it was, and again, my reactions, and sometimes our reactions in our, you know, our grief lined up.
Right.
But then I'd have to talk him down. He'd have to talk me down. Like it was
Yep.
just, it was so different.
It's really challenging and yet becomes potentially a really beautiful experience for you all within your relationship and the whole relationship of your family.
Right.
That,
Yeah.
You know, that's part of what grief does with us and everything in moving us forward in life.
Right.
It deepens our life.
Right.
Yeah.
And then it's interesting too because, I mean, Jonah, again, was 2.5 years old when he was diagnosed. And he was not feeling good. So he was sad and, you know, getting poked and stuff,
Yeah.
which this kid is amazing. Now he draws his own blood from his port. He gives himself his chemo every day. Like he's 3.
Yeah.
So I'm like,
Wow.
It's amazing
It's
how
amazing.
resilient we are,
I'm
right?
like, and
Yeah.
I had to turn to him, a 2-year-old, because I'm like, why am I
Yes.
walking with this dark cloud over me when he's smiling, laughing? He, you know, once he started feeling better,
Yep.
and I'm like, he's not feeling any grief, and it's happening to him. Now he doesn't know what's happening to
Yeah,
him, but
yeah.
I had to turn to be like, okay, I need to feed off of his energy because I'm bringing him down with my depression and my anger and my sadness. I'm like, let's be like Jonah. He's laughing, playing. Let's feel sad when we need to, but right now he's okay.
Right.
Right? In this moment, he's okay. He's
Bingo.
playing, being a kid.
Yep.
But it's
Yes.
interesting because he had no grief.
Yeah.
Wow.
Yeah.
And children teach us so much.
Yeah.
Oh boy, do they?
Yeah.
Yeah.
I
And we
know.
can help children grow and develop within these kinds of situations that I know we'll be talking about a little bit later
Yeah.
with this. So.
Yes. It's a powerful story, Veronica.
Oh,
and thank
I
you
mean,
so much for sharing
Oh,
that.
yeah.
I
You're-
could just sit here and interview you for all
Go
these
for it.
questions
Let's
right
just-
through this,
Yes.
right through this, and everything. I mean, the different reactions that you have, you know, you and your husband have, and Jonah his own self. You know,
Yep.
I mean, children with grief don't they don't have the language that we do to be able to identify things.
Right.
Yes.
And so I might push back a little bit. I don't know, and I wouldn't say it, but I might push back a little bit and say he didn't have grief, but he probably did it in a very different way that you did not recognize
Right.
was his grief process.
Right.
You know, the way he played things. And it may be the sense that he draws his own blood and I give myself. This is part of how I control this. You know, we all grief is an experience where we feel out of control because we are.
Yeah.
Something has happened to destroy or to change our life experience and expectations. And that we need to get, as human beings who are control freaks, all of us,
Yes.
you know, we need to get control back in some ways. And maybe that was a part of what he does. Children do a lot of their grief work through play. And we don't recognize it. They also come, and it may be very dramatic for a little bit and everything, acting out or things like that, where they, you know, they're inconsolable or they're being they're being 2-year-olds.
Yeah. Yeah.
You know?
Yeah.
Yes.
You know, kind of thing, and all, and then all of a sudden it's done, and they're like, you know, playing with their stuffed panda bear or something,
Right.
and just kind of like, and they look fine. Kids do it their own way, particularly within their bodies, which is a huge part of how we do grief.
Yeah, and it's just what they don't have the life experience to, you know, like adults do.
Right.
And his doctor said, you know, it's blissful ignorance. They don't know what they're going through.
It just
in
is.
in the capacity that we do.
Right.
They don't know what cancer means.
Right.
At least at his age. You know, when you get a little bit older, yes, and I can't imagine having a teenager have to go through that and
Yeah.
the stress and the pain. How would you help, or what would you say could help parents? Because, like, for me, when we got it could be leukemia or an infection, or, you know, I didn't even want to,
Right.
I did not even want to think
Yeah,
about
I picked
leukemia.
up on that.
But, yeah, I'm like, it's not that, obviously.
Yeah, it's not that. No, we'll get some antibiotics or whatever and stuff.
Yeah, but what, like, to anticipate the grief that you might feel? Because there was a moment where I was, you know, what if it is leukemia? And even in that quick what if, I thought of course, the worst case scenarios of, okay, well, if it is, then, you know, it's a death sentence and this, and, you know, life's going to change. And life did change. He's doing okay now. But in that moment, it's like you start to spiral because you think of the worst case scenario.
Sure.
So what is a healthy way to process anticipatory grief?
Well, the first thing is just being aware of it, you know, which is so much a part of really just life in general, and therefore is a part of what it means to grieve in a struggle with these words, but we all do, in a productive, healthy way. Okay. It's to stay where you are. You know, you immediately, when that possibility sunk in, of course, you went to the worst case scenario and all. But you found a way to, I think, to pull yourself back, didn't you? Yeah. Oh, I don't want to go there. That's a wonderful answer. I don't want to go there. And frankly, as you know now, there is no need to go there or no reason to go to that point because you don't know.
Right. And that's interesting you say that, because I haven't really tied it to like what our life is like now with this diagnosis. And now we've learned a lot. I mean, we've been in the hospital, you know, 4 months combined, and anytime somebody with a port gets a fever, you have to go to the hospital.
Yep.
Go to the hospital,
Infection.
make sure there's no infection, give antibiotics. So, and you know, a young kid, older brother in TK, now he's in kindergarten. All the germs, we can only isolate us so much.
Yep.
We also tried to keep Benjamin, you know, big brother's life as normal as we possibly could.
Yep.
We didn't take him out of school, you know. But there was a period where I was having so much anxiety. I could like picture germs. I pictured them like floating around and like spraying stuff, and it was causing me unneeded anxiety. And so my husband was telling me, listen, he's going to get a fever. He's going to get sick in terms of a cold and,
Mm-hmm.
these things are going to happen. He's a child with a brother who's in school. You know it's going to happen. Right now, he's okay.
Right.
In this moment today, he's okay. So let's not stress about something that hasn't happened yet.
Correct. Beautiful.
Once you go there, and then it was interesting because he would have to talk me off the ledge,
Yeah.
calm me down. I'm like, you're right. Then would come the time where he'd get a fever
Mm-hmm.
and we'd have to take him in. And it was so weird how calm I was when he actually would get the fever. Because I'm like, all right, I have my car packed. We have his box of toys in the car, his favorite pajamas, his blanket. There's this foundation who donated a galaxy light.
Mm-hmm.
So to make his hospital room more fun,
Cool.
that it's in his hospital bag. He wants one for his room, but I'm like, that makes the hospital a little bit more fun.
Very good.
So, it's like, and he's amazing. He doesn't mind going to the hospital because they're so great to him there. So
Yeah.
I'm like, I'm the only one stressing out here. He's fine.
Yeah.
He's already asking,
Because it for what in the portion of what his life he's lived, it is almost normal.
right.
This is what my life means for me.
Yeah.
For you and the time that you have been living, and for most of us, grief comes from something that has inserted itself that we did not expect, and now we have to integrate that and figure out what that is and how to live with that.
Right.
Benjamin has done that in Benjamin, right?
The brothers Benjamin.
Jonah
Mm-hmm.
has figured out how to do it, and what it means for his life.
Yeah.
That's a way of addressing his grief by keeping, in some ways, it very, if you will, normal.
Yeah.
This is what my normal life is. It's different from others, but this is what my normal life is.
Mm-hmm.
And I think we can take that and extrapolate that out into grief anyway, because one of the difficult things that we have when we're grieving is that we want to judge it against somebody else's.
Yeah. Yep.
Well, I shouldn't feel that way or whatever. Stop that. I don't want to slap people and things. Just stop that. Quit shooting on yourself, as
Yeah.
they say, and
Yeah.
and all. Just let it be. To let it be. Thank you, Paul McCartney. In that wise wisdom, which is what Jonah is doing, and your family is figuring out together. Your experience and your grief would be different were it, you were a smaller, if there were only 3 of you instead of 4, you wouldn't have all the germs that would be being brought home. You could, do things different and all. So we just have to find ourselves and allow ourselves to be present
Yeah.
and work with what we have right now.
Right.
And that's the wisdom that I hear that you all have found already, and that Jonah, in a lot of ways, has taught you.
Yeah. He's a smart kid.
Yeah, we are.
He's remarkable.
Human beings,
He is.
Human beings are amazing. Yeah.
Yeah. I always say, you don't realize how little you know until you have a kid and they start asking you all the questions.
Oh, yes.
Yeah, we don't raise our children. Our children raise us.
So
I
true.
think so.
That's
Yes.
why people like grandchildren so much and everything, because now they can have fun.
Yeah. I've never used Google more in my life. I'm like,
No.
why is the sky blue?
Yeah.
Yep.
One of the things that I think would be helpful for not even just parents, but somebody who knows family member, loved one, friend who was diagnosed with cancer. How can they balance staying strong for the person that's needing the strength while also grieving themselves?
Sure. Let me start to answer that by asking you, define the word strong.
I don't know. Strength, I feel like, is different for everybody, really. I feel like strength for me has changed.
Sure.
Now I feel strength as, and this might sound selfish, but it's the reality is you're strong, you're pushing through, even though you don't want to.
Right.
Yes. That's profound.
Yep. Yes, it is. I don't want to do this. I did not sign up for this. This sucks.
And that's
Yes.
where my
say that,
yeah,
you know, it's
Yes.
that's where my
It's true though.
and that's why
sucks.
I was so angry
Right.
because I'm like, well, we had to go again. Childhood leukemia is a 2.5 year journey. It's not like
Wow.
and not to discredit any of the other cancers
No.
because it's all again we can't compare.
Right.
Because I've seen other cancer stories where I've seen a kid who had a brain tumor and thank goodness he's okay now. But like the chemo he was getting was way harsher at a point, so it's like you can't compare.
Nope.
But I was so mad and everyone kept telling me, you are so strong. You're so strong. And it wouldn't make me angry, but I would have this feeling of like, well, yeah, because I have to be. I don't
Right.
want to
Exactly.
be strong.
Exactly.
But I don't have a choice.
Exactly. So, going back to your question now, I think somebody wanting to support you in that can be a very painful statement. They're trying to do that to make you feel support and things like that. You are just, I can't imagine. You used the word earlier. I can't imagine going through that. What amazing parents you are, what an amazing family you are and stuff. And for many of us, all it is like, yeah, you don't see me at home when
Yes.
I am coming
Yeah.
unglued.
Yes.
When I am screaming at the top of my lungs, or I have no more energy, I can only crawl into bed
Yeah.
or lay there or whatever. You don't see that. It's much better in supporting other folks, to be curious about them. Not the general, how are you doing, which we often say, because Luz, how are you doing today? You're
I'm doing good.
you're
I'm doing
fine.
fine.
Right. We just have this normal kind of thing that we just sort of, society has taught us to respond. I'm fine. Great.
It's
and
the
stuff.
Automatic response.
It is. And to get past those things, we have to be a little bit more creative. Instead of asking, how are you doing? Is, what are you feeling today? What's going on today? How is your moment now? Or how has today been for you? Specific, bringing those things into kind of a specific question really tells the person that you're interested in them in that moment and what's going on, not just your perception of them.
Right.
It lets them know that you're trying to be a safe person
Yes.
for them. Safety and grief is a huge part of it. We have to feel safe with the folks that ask us those things. And you've done, you know this in your own situation. There are some people who will ask you about your family and stuff that you have no desire to talk to them about it, get into it with them or anything, because they're going to try to fix it.
Yeah. Yeah.
They're going to tell you how strong you are. They're going to tell you it's going to be all right. They're going to tell you all of that stuff that, is good on one level, but in the reality of your world doesn't hit right.
Right.
Yeah.
But I also know, just from my experience, and it's easier said than done, is I try to tell myself, they're not being malicious asking me these
Exactly.
questions. They
Right.
are being kind. They're being kind telling me I'm strong. And
Right.
let's be real, like, as much as I don't want to be strong, it is a nice reminder sometimes.
Sure.
Like, you are being strong. Like
Sure.
this, you are being a great mom. You
Right.
for Alex, you're being a
Absolutely.
great dad.
Yes.
So it's like, it's okay to say those things to people. And I feel like, as on the cancer side of it, even though sometimes it is like, I don't want to hear that right now,
Right.
you have to let somebody, like, they don't know what you're going through. So you
Right.
can't expect somebody to know all the right questions to ask you.
Absolutely.
And
Yes.
so it's like, just take it. They mean well.
Right.
So, even though it doesn't always, and again, sometimes it is nice to hear. It's not
Right.
always nice to hear.
Right.
It's okay. They mean well. They are not going to know everything to ask you. Because I know before Jonah's diagnosis, I didn't really know anybody really, like in my immediate family, who had cancer. My grandpa did when I was in elementary school.
Yeah.
He's fine now, and I remember him being sick, but it didn't mean as much to me.
Right.
So now I'm on the other side of it, and I'm like, oh my gosh, all the questions I've always asked people,
Right.
you know?
Right. Yeah. I had a woman one time come to me in a grief seminar who, after her mother died, she said, I need to find everybody whose mother died and go and apologize to them
Yeah.
because I didn't understand what I was saying to them. You know, and I love how you have taken charge of your experience, which is really important. They mean well. They're not being malicious. That's a great way of dealing with all of the stuff that's out there, is to try to have a better perspective on one that doesn't immediately go to, you know, kind of a negative place
Right.
or something. In speaking to people that want to be supportive and all, it is helpful for them to understand that they need to ask about your situation and your time and where you are right then. It may be a great day. It may be a day that you're having wonderful.
Yeah.
Be curious about it. That's what I'm. They are going to have their own grief, and one of the things that is very powerful and helpful for people who are trying to be supportive and yet have that grief experience because they love you, they're connected with you, is that if I can support them, that is them working on their grief.
Right.
Because it's a different experience.
Yeah. I think about my parents. It's
Oh,
like
yeah.
their grandson got a cancer diagnosis.
Yes.
You know, so it's like they're going through their own
Right.
process of grief while trying to support us.
Right.
So it's, you know, and
Yeah.
their experience was totally different.
Right.
And they're telling me I'm being strong, and, you know, they're telling me all the things, but they're going through their own process
Right.
too.
Right.
So
And I suspect, I would suspect that you ask them back at different times, how are they managing?
yeah. Yeah.
So that you provide that open, safe space for y'all to talk together about it.
Right.
Yeah.
Yeah.
You know, Veronica, you've shared your story, which is amazing, and it's very powerful.
Yeah.
It's profound, and I know it's going to help many of our listeners. And we've also heard, you know, your experience and the type of grief and all the emotions that, you know, were involved in your journey. How Veronica has described her journey, it's as though she was mourning through this process, and she was in many ways the life that we thought we would have had. You know, how can parents navigate that sense of loss while staying present for their child?
Yeah. Yeah, that is a big part of that experience of grief, and that is the loss of the expectations.
Yes.
You know, we all have sort of this internal script within us that of, you know, children, and they're going to grow, and, you know, the different things that it's going to bring, vacations and all this different kinds of stuff. And when cancer comes in for a child or for even an individual, you know, a single individual, it's going to impact how they look forward in their life and those expectations they have. It may take some things, out, or it may adjust them. Again, the key thing with that is acknowledging the loss that you experience when you bump up against that expectation. You know, this is a part of, I talk about, you know, grief sometimes being like an octopus, you know, and you're swimming in your ocean of your life and everything. And you know, this octopus is floating by, and then one of these tentacles just sort of floats by and gets a hold of you, and you become aware of it, or maybe it's got a stinger on it or something like that, and it's like, ow, you know, you get your grief activated in that moment with something you didn't expect to come along with. You're spending your time in the hospital instead of on a family vacation that would have been that.
Yes.
You know, you're going to chemotherapy or have to plan for surgery instead of being able to, you know, write your resume that you were going to do for the new job that you were seeking. Depending upon, you know, what stage of life you're in, there's all these kinds of expectations that we have. And when you bump up against them, I would say the best, and that's a funky word, but I would offer to you to receive that moment and all that's going on. Maybe your experience is like your husband and you burst into tears. with that. Maybe it's the, okay, I will shift and pivot, and now I will look at it this way and do that. Again, it's different for everybody, but to receive what that moment is, and if you can identify what has been lost in that moment, or what you think may be lost, that's part of that anticipatory. We never know for sure until we get there.
That is so true.
Yeah.
And the loss feels as though we're out of control.
Absolutely.
It's not within our control. This was not supposed to happen.
Right.
This was not part of my plan.
Mm-hmm.
And it almost, just thinking about it in that way, it almost triggers anger in many ways.
Well, it does. And because anger is, and we don't like to think about it, but when I will ask people, okay, tell me what are some of the emotions that you experience in grief? Anger comes up either first or second, almost always. The lowest I've ever had it show up in 2 decades of really significantly doing this is third.
Wow.
Anger is one of the ones, because it is an assault, whatever it is that we've lost, on our expectations, on our assumptions about ourselves, about what we think life will be or was going to be. And it's like, wait a minute, this isn't fair.
Exactly.
This isn't right.
Yes.
And so it's common. It's a very common kind of thing. How we respond to the anger is what becomes really important with that.
Oh, absolutely. And when it comes to, having this feeling, that we've lost something, or feeling that, this is out of our control, what can help families maintain that hope when the future does feel uncertain?
Yeah. Well, and again, it's staying, it's a pretty almost hackneyed statement today, but it's staying present. It's, being, as they say, where your feet are.
Yes.
Anxiety comes because we are living out in front of ourselves.
Yes.
We're living in a time that is out in front of ourselves. And really, it is an unknown. We, as human beings, don't like that. We like to know what to be expected. And even if we don't know, how to prepare for that.
Yes.
When we start feeling that anxiety, if we can use that as an awareness to bring ourselves back to the moment. Like you said, Jonah's, he's doing his thing. He's playing, he's doing his stuff, he's living his life. Right now, he's happy. That's okay. So bring yourself back to this moment. Am I safe right now? If I'm safe right now, then that's the starting place where you can be.
Yeah. And if you don't live in the moment, you're robbing yourself of the little bit of happiness that you can feel.
Oh, that's a great point.
Oh, absolutely. Absolutely.
And I was missing so much happiness and joy. And I'm like, I have my boys with me. I'm in a happy marriage. It's like I'm living the life that I always wanted.
Mm-hmm.
There's this little bump in the road, but I was just like, I'm so angry and sad and mad. I'm like, I miss being happy.
Yep.
So I'm like, right now I'm going to be happy. And that's kind of what helped me kind of pull myself out of that, because I'm like, I miss feeling joy.
Right.
So today I'm going to feel joy, because today everything's okay.
Right.
And then I realized things are okay in longer increments than I realized.
Mm-hmm.
I had the grief and sadness and anger, but it was becoming less because I was letting myself feel joy.
Right. And you're processing it.
Right.
You're processing what all these changes mean for you. And you're not living in that moment of, yes, he has leukemia, and that means he will die.
Yeah.
Which is where we oftentimes go, as we said. So processing grief doesn't mean that we're not done with it, because grief is a never-ending thing. It is, again, it's something that we have all the way through our life. And as we grow, I like to encourage parents to teach their children how to grieve when they've had a moment, such as a pet die, or they see the earthworm on the ground that's dead or something like that, to help them understand about loss, life, the trajectories and cycle of it, and particularly like when a pet dies, that yes, we're going to mourn this pet. have a ritual around it, which is something we, is really important in grief and everything, is to do rituals with that. They really help us process that
Memorialize.
stuff. Memorializing those things. So maybe you have a service for the dog or the cat or the bird or whatever it is and everything. But too often, parents, to try to make children feel good. We're going to protect them. We want to protect our children. It doesn't come from a bad place. But instead of teaching them how to do their grief, they try to mask it. And the dog dies, and 3 days later, there's a new one. Oh. And we learn replacement theory, if you will.
Right.
We learn this replacement kind of thing for that. Oh, the dog died. Okay, then we'll get you another one.
Yeah.
The cat,
you lost your toy. We'll replace it.
We'll replace it. What we don't understand, and this is kind of the bottom line of grief and understanding that comes. Grief comes from attachments. Whatever you're attached to, if you lose that in whatever way it is, that is the equation for grief.
Wow.
So talking about self-identity, a woman gets a diagnosis of breast cancer, begins the treatments. It causes her to lose her hair. Maybe her hair was something that she was, it was really an important part of her. And I pick on hair because I don't have any anymore. It used to be mine. So it's an easy kind of thing for me, It changes your identity. Yes. I'm used, I look at myself and I don't have the beautiful long jet black hair, this wavy, wonderful brunette, mane around my face that people like and I like, and it's a part of my identity. And now I'm a cue ball, and that feels really odd. Who am I without this? Mm-hmm. And some people will want to downplay that, because they learn about it. You may lose your hair and with your treatments. Some people may it may not be a big deal for them and everything. Again, that goes back to that, how each one of us, kind of incorporates that and experiences that. But you have to receive whatever that loss is, and to recognize it and acknowledge it, and maybe have a ritual around it, or be with it in the middle of it. Back to the supportive thing. We hear all the time of folks, somebody has a cancer diagnosis, loses their hair or is going to lose their hair, and what does their family do? They shave it all off to be in solidarity with them.
Yes.
What a wonderful way to support. Hair is not important.
Right.
It is and it's not. It's not in the grand scheme of things. What's important is you going through your treatments to return to the health that we want and desire for that.
Yes.
Galen, I know you also worked as a pastor,
Mm-hmm.
And I know that can help a lot of people go through the grieving process. I'd like to talk to you more about that in part 2, if you don't mind.
Absolutely.
If you could stick around for a little bit.
Absolutely.
All right. Well, we'll be back with part 2.